The main type of cases that I've treated on the CyberKnife system have been patients with early stage non-small cell lung cancer. This is routine standard of care to deliver stereotactic radiotherapy for patients who are considered inoperable or who aren't keen on proceeding down the surgical route. Our clinical use on CyberKnife in general is increasing because we're seeing more indications coming through for stereotactic radiotherapy. I personally treat lung cancer, and therefore, as well as the early stage lung cancer patients, we're seeing more indication for treatment of oligometastatic disease in the various different settings. And that's not just the lung metastases, that's metastases from various sites around the body, with increasing numbers of patients coming through for treatment. So with the CyberKnife system, I particularly like using this as a solution for patients with certain types of oligometastasis. So take, for example, adrenal metastases. Because we're able to insert fiducials and use the tracking system, this really does give me confidence in the delivery accuracy, particularly bearing in mind the close by normal tissues that we're keen to avoid treating. So in general, as I say, we're seeing increased use of stereotactic radiotherapy for oligomets with increasing international data and more trials coming through demonstrating the likely clinical benefit. At the Royal Marsden, we're not only treating metachronous oligometastases routinely, but we also have trials open looking at stereotactic radiotherapy in different settings. For example, synchronous oligometastases for non-small cell lung cancer, and also in the oligoprogressive setting for mutation-positive patients with non-small cell lung cancer. So with the new CyberKnife 7 system, the main benefit I see for patients is that the treatment time is much quicker for patients, and particularly bearing in mind our patient demographic when we're talking about early stage non-small cell lung cancer. These patients tend to be fairly elderly, and patient comfort is of paramount importance during treatment, and therefore the faster the treatment, the easier it is for patients to tolerate, and their overall experience of treatment is optimal. So to summarise the new CyberKnife system, if I were to give 3 words, I would say speed, precision and motion synchronization.